what do you think is responsible for this outbreak of polio in Pakistan?
Amy, thanks for having me on. I think, in Pakistan right now, what you see is kind of the perfect storm, where there's a collusion of factors coming together to cause a tremendous health emergency for Pakistan's women and children especially. You mentioned the CIA program that was used, the fake vaccination program that was used to collect DNA. In addition to that is the fact that the Taliban have been, since then, targeting the health workers that provide immunizations in Pakistan, polio immunizations in Pakistan. And the third factor is, of course, just, the underfunded nature of the Lady Health Worker program that provides these vaccinations. So all of these three factors have essentially come together to create a situation where in just 3 years, just 3 years ago, Pakistan was about to eradicate the polio virus. And you can see just across the border in India, where these political events did not happen, they did eradicate the polio virus. But we see 59 new cases. The cases are spreading, as I'm sure Dr. Bhutta will talk about. They've spread not, they used to be just in the tribal areas where the drone attacks are concentrated, and in Peshawar, which is the biggest city next to the tribal areas, to now all the way south in Karachi, which is a city of 20 million people, where the spread of viruses like polio can happen very, very fast. And you have to remember that these health workers that are at the front line of this anti-vaccination, this vaccination campaign, are paid $2.50 a day. So you have to see how the people who are at the very front lines of this battle, who are trying to get the virus under control, not only do they have very little remuneration, they have no security. So they're easy targets for the Taliban and other extremist groups. But the core issue, the central issue, is an issue of public trust. It is unimaginable that in the Western industrialized nations of the world, that a public health program would be allowed to be used as a front to essentially forward a strategic interest in capturing one or another person. But this is what has happened in Pakistan. And so you have a situation where among the rural areas especially, and also in the inner cities of Karachi and in Peshawar, people don't trust the vaccine. They don't know what it does. First there was, when there's a rumor that says that Pakistani children are being sterilized by this vaccine, and then you have the truth of the fact that the CIA did use the program, it's very, very difficult to convince people, even educated people, that the vaccine that their children are going to get is one that hasn't been tampered with.
Dr. Zulfikar Bhutta, can you respond to the virus and the polio emergency that's been announced by WHO and what's happening in your country of Pakistan?
Well, thank you very much, and I'm grateful for the invitation to join you this morning. Let me just add to what Rafia said. I mean, where I agree with her is this current perfect storm of a variety of issues and the lack of public trust in a broad polio immunization program. However, I don't think the blame for the failure of polio eradication in Pakistan can be placed entirely on the bin Laden episode, which, deplorable as it was a problematic issue that happened at a time when we needed to build public confidence and not the opposite. What has happened in Pakistan is that you have virtually a civil war going on in some parts of the country, notably in the federally administered tribal areas, the Taliban-controlled areas, where nobody can enter. And yes, of course, health teams cannot enter. And as a result, it's been impossible to vaccinate large bodies of children, and people moving out of that area have been able to carry viruses to all parts of Khyber Pakhtunkhwa, the neighboring province, and because there's a large proportion of people who travel down to Karachi and migrate there, there is also transmission of virus in those areas. So there is a very close link of polio program in Pakistan with the barriers of conflict and war. And as you can imagine, in the parts of the world where the virus has spread or re-emerged, these are also geographies where there has been conflict and a breakdown of primary care and health services. Somalia, Syria, the isolation of the virus in Iraq, parts of Afghanistan. So I think it is important to recognize that we are trying to eradicate a disease globally in the midst of very adverse situations, of which there are a range of factors, including conflict, breakdown of public health services, disinformation, which is flamed by incidents such as the Shakil Afridi CIA ruse, and also the fact that the disorder is now unfortunately being politicized. The Taliban have deplorably not only resorted to attacking health workers and thereby creating this climate of fear amongst the primary care health workers program and the population, but have also used polio as a vehicle for political negotiations. The North Waziristan Taliban leaders stated that they would only really allow polio campaigns or polio entry into their area if the drone attacks were stopped. So it is a very unfortunate situation which does place a huge responsibility on everybody concerned to take a very rational, balanced approach to what needs to be done and not a knee-jerk response.
Dr. Bhutta, your response to the WHO recommending all residents of Pakistan should show proof of vaccination before they can leave the country.
Well, I can understand where WHO is coming from. They are desperately trying to contain the virus from spreading to other geographies. But I do have some reservations on the whole gaming of what might happen with such a draconian imposition of travel restrictions. Firstly, Pakistan is not a small country, so you're not talking about just a few thousand people traveling. You're talking about millions of people, the diaspora who live in the Middle East and who travel all over the world, people who travel between the West and East. So it was always going to be a huge challenge in terms of implementing such a restriction. Secondly, there is a real risk, and we are already beginning, as people on the ground will confirm, to see a response that is taking away from the core process of focusing on eradication of the disease in the geographies that I mentioned. The government has been forced to set up these vaccination centers in over 130 hospitals. It's been forced to set up vaccination points at all ports of exit and airports. That will require human resources. That will require a vaccine transportation chain. That will actually require vaccines. Already I've been told that there is insufficient polio vaccine to vaccinate all travelers, oral polio vaccine, and the government is desperately trying to get the injectable vaccine for adult travelers. Now, all of these things will, I'm afraid, take away from the core focus of the program on trying to vaccinate people in at-risk populations in the districts of Karachi, in the FATA areas, strengthening the community program, the Lady Health Workers program, as well as the vaccination program, integration with other services. Those are things that require resources, both human and money, and I'm afraid these travel restrictions may look cosmetically as appropriate, but I don't think they will do much good in terms of the National Polio Eradication Program.
Finally, Rafia Zakaria, you report for Dawn, the newspaper in Pakistan, but you're in the United States. Your message to people in this country who might have no idea what happened with the Osama bin Laden raid, the special forces, and how they found him.
Well, I think I would like to speak for the Pakistani people who are kind of caught in the middle of this conflict. On one hand, you have the CIA and the US government looking at their strategic objectives of catching bin Laden. And on the other hand, you have the Taliban, whose agenda is basically to destroy Pakistan, to spread terror in any way they can. And the tragedy is that neither side seems to care at all about the Pakistani people who are caught in the middle. So now the US has Osama bin Laden and they have a victory that they can tout, But the fact is that in the 3 years after that raid, we've got a polio outbreak in Pakistan, and extremist groups have actually been able to increase their number of attacks. The casualties, Pakistan is now the number one country in the number of terrorist attacks than anywhere in the world, more than Iraq and Afghanistan. And so, I mean, the question becomes is, you know, for Americans, is that what has the war on terror really accomplished? Not only do you have these extremist groups able to expand their areas of operation, but now you've got a huge public health crisis in Pakistan. And I think Dr. Bhutta gave a really great insight on how Pakistan just does not have the resources to contain both of these problems. So I think that Americans have to move beyond this kind of idea that killing one figurehead and the number 2 leader and the number 3 leader is winning the war on terror. They have to look at the cost of this that's imposed on countries like Pakistan, and especially on the innocent civilians. You know, the final consequence that I think your listeners should consider is that because of this war, a functioning program, the Lady Health Worker program, that used very little money to provide basic health care to millions of Pakistani women and children, is now essentially being scrapped.